So this legal back and forth comes as South Carolina is now leading the nation in a dangerous ranking. An American Academy of Pediatrics report says the Palmetto State has the second highest rate of COVID cases in children.
And some are pointing to the lack of face covering rulings in the classroom as a contributing factor. Our Brianna Harper spoke to South Carolina parents on both sides of the mask debate.
More than a year and a half into this COVID-19 pandemic, and there's been plenty of changes.
With the new variant, we have a totally different picture. And this time, kids are more affected.
Physicians at Carolina Pediatrics in Rock Hill say they see young patients with COVID nearly every day, some with mild to serious symptoms. But that's just a snapshot of the nearly 14,600 child-age COVID cases seen throughout South Carolina for every 100,000 children, making the Palmetto State the second highest in the country. And the percent of childhood COVID cases in South Carolina is almost twice the national average, according to the American Academy of Pediatrics.
Kids are not as, able to adapt to precautions as adults are. As parents, really, it's our responsibility to help our kids to fight these.
Doctors say hand washing and masking are the top COVID fighting tools, but these opposing parent groups outside the Fort Mill School Board building each have different messages to share when it comes to masking.
It's a burden on the teachers to have to teach students that can't be in school because they're quarantined or that have COVID. And if we can keep those numbers down, why wouldn't we try when it's as simple as wearing a mask?
Meanwhile, Moms for Liberty shared this statement announcing their opposition to mandatory masks and requirements for quarantining certain students. For now, Fort Mill, like many other South Carolina school districts, will remain mask optional. While some doctors remain concerned less protection could mean more COVID cases for children continuing.
But what worries us the most is the fact that the people that are presenting with COVID not necessarily present with a clear picture that can tell us this is the child that will for sure have COVID.
Brianna Harper, WCNC, Charlotte.